Support for the Idaho Matters podcast is brought to you in part by University of Idaho, Idaho's only Carnegie R1 classified research university. Our Carnegie R1 designation recognizes the discoveries we make that help our forests thrive. It means we're creating more doctors and doing real research to strengthen cybersecurity for Idaho businesses, our energy sector, and every Idahoan. More at go.uidaho.edu/Idaho-is-Idaho.
Hundreds of bills move through the Idaho legislature each session, and it can be hard to keep track of what's really at stake. The Connector follows the legislation that's gaining traction with clear reporting and local context you can trust. Stay connected to the State House with The Connector, Idaho Daily News. Listen wherever you get your podcasts.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. This week marks 1 year since the measles outbreak in West Texas set off a chain of events that public health experts say has changed our country's relationship with the disease that many Americans had stopped thinking about. But since then, the U.S. has seen new measles cases every single week, with large and growing outbreaks in states like South Carolina, as well as along the Utah-Arizona border, and more than 2,000 cases nationwide last year alone. And most of them were in people who were not vaccinated. Now, measles was declared eliminated here in the U.S. back in 2000, but today that status is at risk. And public health leaders are warning that declining vaccination rates, as well as mistrust of medicine and policy choices, are making it harder to stop the virus from spreading. And here in Idaho, where vaccination rates are among the lowest in the country and state law limits vaccine mandates, the question is no longer whether measles could return, but how prepared we are if it does. So to help us understand what this moment means for Idaho and the rest of the country, Dr. David Pate is joining us today. He is the former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. Hi, Dr. Pate.
Hi, Gemma.
And folks, remember, if you have a public health question for Dr. Pate, send us an email, idahomatters@boisestate.edu. So, Dr. Pate, I want to start off our conversation today really with more of the national picture, if we could. So what stands out to you about the way measles has come back really into regular circulation here in the U.S. over the last year? I mean, given that it was considered eliminated 25 years ago.
Yeah, this is something that most of us could never have imagined that we would be in the place we are today, say 5-10 years ago. We just never would have believed this. But yet what we see is that there is so much disinformation and misinformation out there that there are enough parents that are not convinced, or they're skeptical, or they just frankly just don't believe it, that that measles could be getting the measles disease could be any worse than getting the vaccine, which is crazy. This vaccine is extremely safe. We have used it for decades now, and we're very familiar with it, and it's a safe and highly effective. As you said, most of these cases, and in fact, it's like 97% of all these cases are in the unvaccinated. And so it's really shocking. And I think it's not as shocking for most of us recently with all the anti-vaccine rhetoric that there would be outbreaks. But the fact that this outbreak just keeps growing and growing, and now South Carolina is probably within this week or next going to eclipse the total number of cases in the original Texas outbreak last year. And what we're seeing is not there's a lot of measles. Now we need to get our kids vaccinated. We're seeing that there's not that many people responding and trying to get their kids vaccinated, even in the midst of this huge outbreak. And so we're very discouraged.
So let's talk from a clinical and hospital perspective, because how does a measles outbreak like the one that we're seeing in South Carolina right now? And we should note, as I mentioned, there's an outbreak right at the Utah-Arizona border, so not far from us. What kind of strain does that put on local healthcare systems, especially pediatric care?
Yeah, so this causes a lot of problems. Number one, it causes a problem with how are we going to contain the spread if parents won't get their children vaccinated? Vaccine is how we stop these outbreaks. And we have to get, like I said, somewhere in that neighborhood of around, maybe 95% of those that would be in the area and exposed to the virus vaccinated in order to stop the measles transmission in its track, because measles is the most contagious virus that infects humans that we know of. And so it requires a very high level of vaccination. And if we can't get people to agree to get vaccinated, then we can't stop measles from transmitting. And I see people out there that have no business touting what they do, but promoting, hey, you don't have to get the vaccine, just take vitamin A or something. That is so irresponsible and so wrong. That is not going to stop measles, and that's not going to help these children. So what is going to happen is it's going to spread. When it spreads, several things happen. First of all, it's so contagious that your chances, if you're unvaccinated and you are exposed, are quite high of getting infected. If you get infected, we're going to see maybe 20% of those cases get sick enough that they need to be hospitalized. That could be pneumonia, that could be encephalitis, it could be a number of different things. But that's going to be a strain on pediatric hospitals. What has happened over the last number of decades, because we have been eliminating these diseases, because we have been keeping children healthier, is we've dramatically reduced the number of pediatric hospital beds in this country. And that is true in Idaho as well. And we could certainly get overwhelmed. In addition, when you have so many infections occurring, you're going to start seeing children die. And we had 3 deaths last year already, which is more than we had for the prior quarter of a century. It's staggering, and we're going to see more. And what also is going to happen is some of these people that are infected are then going to infect infants that are too young to be vaccinated, and they are going to have very severe problems, and they are going to end up in the hospital. And we're going to infect pregnant moms. And if those moms are not vaccinated, then this is going to cause problem for both mom and baby. And so we have all of that. And then what happens is when you get measles, the virus infects a certain type of immune cell in your body that makes antibodies to things that you were previously exposed to. So, for example, you have certain immune cells that, because you've gotten tetanus vaccine, that would respond to that, or diphtheria would respond to that, or something else. And what happens is this virus can destroy those cells. So what happens is, for the next few years, children that got measles will have what we call immune amnesia. And to some degree, and it varies in all of these children, they will lose the immune protection to other infections. So we're not just going to be dealing with measles, but for the next several years, we're going to be dealing with kids getting infected with things that their parents thought they were protected from because they already had. So it's going to be a terrible cycle. It's going to cause a lot of demand on the healthcare. And this is going to be at a time when, guess what else is happening? People are losing healthcare insurance. Without the renewal of the subsidies, there's going to be a lot of people that aren't going to be able to afford insurance plans. And then they're going to have a sick child that requires care, and they're not going to be insured. And it's just going to be a vicious cycle.
So let's shift to Idaho specifically, because data shows that Idaho has among the lowest reported MMR vaccination coverage in the country. with kindergarten coverage well below 90% and significantly under the 95% herd immunity target. So, how concerning, Dr. Pate, is that to you for preventing outbreaks right here?
Well, it's always very concerning. Now, one thing I will say is that um, I'm not sure our rate is actually that low. And the reason I say that, and frankly, hope that is not true, is because parents can just opt out from reporting. And if parents did get their kids vaccinated, but feel like, I don't think this is anybody else's business and don't want people to know, that may be underreporting. Nevertheless, I have no doubt in my mind that we are very vulnerable here to a measles outbreak. I just think that our level might be a little bit higher than what they're saying. I think we have to
Mhm.
prevail on parents. Look, please talk to somebody that you trust. Listen to this show if you trust me. Talk to your doctor. Talk to somebody who you can count on to have your interests in mind, not somebody that wants to promote misinformation so they can sell you supplements or vitamins or whatever. Get good information. And please get your children vaccinated. If you are under the impression that getting measles will boost your child's immune system, which is a common misunderstanding. Please know that is completely false and that them getting infected may actually hurt their immune system. We
Mhm.
have a safe vaccine, despite what you've heard. We can give your children essentially lifelong protection. Please get vaccinated. But if we don't, we are going to, it is just a matter of time. It is going to happen here in Idaho, and it could be very soon. As you said, it's encroaching on our borders and people are traveling throughout the country. It's just a matter of time.
Dr. Pate, you're well aware that Idaho also passed the Idaho Medical Freedom Act, and this prohibits most vaccine mandates. So, what impact do you think that law has on public health efforts to even increase vaccination rates and respond to outbreaks if we have one?
Well, in a situation like measles, where we don't have an antiviral, despite what people say, giving your kids vitamin A, that's not going to prevent them from getting measles or prevent a case of measles from getting bad. Because vitamin A deficiency is just so rare here in the United States. That happens in other countries where vitamin A deficiency is a real problem and it will make measles worse, but that's not a US problem. So we just don't have any other options. So if because of all the outrage about COVID, which is completely different than this disease, now we have overreacted and we say, now public health officials can't require any other vaccines, then that means we can't control an outbreak. It's all up to the parents to just decide whether they want to have their kids protected. And unfortunately, what really hurts my heart is there's going to be parents who love their children so much, but they were deceived. And then that child is going to be gravely sick or ill in the hospital or die. And I'll tell you what, it breaks my heart that they're going to have to go what they're going to have to go through before they realize they were duped. This is what happened in
Hmm.
Ohio a couple years ago when there was the big outbreak there. And then it was just heart wrenching to listen to parents who lost their children go on TV, go on radio and say, look to our other parents, we were deceived. Please get your kids vaccinated. We fell for the disinformation. We didn't. Our child has died. Please get vaccinated. That's going to be a terrible situation, but that's probably what it's going to take.
Dr. Pate, before we go to break, very quickly, as we've just talked about, so many Idaho parents, they're just hesitant about vaccines for a variety of reasons, right? So, are there effective ways that clinicians and public health officials can communicate the safety and the importance of the MMR vaccine?
Yes, it's tough, let me tell you, because it depends on how ingrained their notions are. But I know that at least talking to two people, I've completely changed their views, and they were in the category of like rock hard anti-vaxxers. They called themselves that themselves. It can happen, but it is very difficult. One, it needs to be a position of trust. What both of these individuals told me, the reason they trusted me is that I didn't get caught up in the hyper-inflammatory rhetoric. I wasn't calling people names or making people feel that they're stupid or that they're this or that because of their beliefs. I sincerely believe that most of the parents that are not getting their kids vaccinated, they just don't know what to believe, or they're confused, or they think, well, the better part of caution is just not to get vaccinated. And unfortunately, that is not the case. And so I think we just have to have honest conversations. They need to know that they can trust us, and then be willing to explain why. Some of us older doctors, we've seen these diseases. We can tell them from firsthand experience. Some of the younger doctors, it's very easy. I think that one of the most compelling ways is give somebody something to look at. Give them pictures of what it looks like when kids have the disease. Give them pictures of the graphs that show the difference between vaccinated and unvaccinated. Try to make it simple. Try to condense it. And there's lots of good resources out there, and we've mentioned those on the show before, that can be used.
So, a major new review published in the Lancet Obstetrics, Gynecology, and Women's Health finds that using acetaminophen as directed during pregnancy does not increase a child's risk of autism, ADHD, or intellectual disability. Now, these findings come after years of mixed studies and recent high profile claims that have left some pregnant women confused as well as concerned about what pain relief is safe. So, Dr. Pate, for listeners who may have seen these really alarming headlines over the last couple of months, what is the most important takeaway from this new Lancet review?
The most important thing to know is two things. First of all, that what you have to realize is that fever, inflammation, and infections are very bad and tough for the fetus during pregnancy. That's why we treat fevers, treat pain, treat infections so that it doesn't harm the fetus. We know that if we are going to treat those things, the safest drug is acetaminophen compared to all the other potential medications we could use. Secondly, we know if we don't treat those things, it can cause neurodevelopmental problems in those unborn infants. So, when the study came out suggesting that acetaminophen might be associated with these neurodevelopmental problems, we're talking about autism, ADHD, intellectual disabilities. Those that were responsible scientists and physicians said, wait, that is association. It doesn't mean causation, because what you do is you ask yourself the question, well, wait, why would a pregnant mom be taking acetaminophen? You don't take that like a vitamin, something routine. You take it for a reason. Well, the reason they're taking it is because they have fever, infection, or pain. And all those things we already know. Those are the risks. And so this study was able to sort that out, because what we could do is focus particularly on sibling studies. What that means is that we take, for example, you, Gemma, let's say with one of your pregnancies, you did take Tylenol, but with the other pregnancy, you didn't have need for it. We could look at your two children then and compare them, because they have very similar genetics. They have essentially the same environment. So we're taking those factors away. And when you do that, what you see is there's absolutely no difference in the rate of autism, ADHD, and intellectual ability between those sets of siblings, whether they got acetaminophen or not. So I think we can put that to bed for now. And women, please don't be terrified by the possibility of taking acetaminophen, because you have to understand the consequences of not taking it. So do talk to your obstetrician about this, get good information, understand when to take acetaminophen, and when you need it, but take it in the lowest amount that's
Mhm.
needed.
So I want to talk a little bit more about this sibling comparison study because, as you just said, I mean, I had two pregnancies. In my first pregnancy, I did take acetaminophen one time, and my child does not have autism or ADHD or anything like that. My second pregnancy, never took anything. Guess what? I have a kid with ADHD. So why is this particular study design considered stronger than many earlier studies on this topic?
Well, because it's very hard to separate associations into whether they are just that, association, or cause. And when something is associated with something else, it is going to show up in increased frequency when you're looking for whatever the underlying factor is. The problem is, can we sort it out and say that, well, no, this is just associated because you would normally do this even in this situation anyway, but it's not what's causing it. And that's where having a sibling with something as complex as autism, it has genetic factors, and that's probably the bulk of the risk. And so using siblings helps us calibrate and kind of make that all equal. So that kind of removes that factor. There are definitely associated environmental exposures that can lead to that. And so, given the likelihood that the environment one of your children was raised in is so similar to the environment the other, that helps remove that. So that's the benefit of doing a sibling
Mhm.
study when you're looking at something that's very complex like this.
So the FDA has said there is no evidence that acetaminophen causes autism. However, it's also noting that there's ongoing debate. So, how should the public interpret that kind of messaging?
Well, I think what we saw with the FDA is them torn between two masters. The FDA is under RFK Jr. But the FDA has had a history of being devoted to science, and so it was torn by the two masters. RFK Jr. that wants to create all this alarm and nonsense, and science, which wants to tell, hey, here's what this really means. I think that they tried to do both. And so,
Mm.
on one hand, they said there's really no scientific evidence for this, and that is a true statement. And then, but they add on a but. And when you add on the but, what you're doing is just creating that uncertainty, that confusion, that angst. And so that part, I think, was intentional to satisfy other ideological agendas, not scientific agendas. So you
Oh,
need to find trusted information.
so I want to switch gears now with our last remaining time and talk about another study. And this is the results of a study about Mpox, Dr. Pate. Can you tell us what does this study tell us about Mpox as a long-term health issue, rather than just an acute infection that usually resolves in a few weeks?
Yes. So people may remember that in 2022, actually in May, we had an outbreak of what was then called monkeypox. And that was a disease that formerly we pretty much only saw cases in Africa. It was not something that was spreading rapidly. What was really the big shock in 2022 is that all of a sudden, this virus seemed to change its transmission mode. That is extremely unusual. And it began spreading all over the world. In fact, the United States ended up having the second highest number of cases anywhere. And so, number one, it is a point towards the fact that this is an interconnected world. And if things are infectious, even if they're just showing up in one part of the world, we need to be taking that into consideration. The second thing was monkeypox. It presents itself usually by the presence of rash, and it's a kind of a blistering rash. It looks can look a little bit scary, but it's also extremely painful. And so we had an antiviral, we had a vaccine, and we were administering it to people. The United States had over 30,000 cases before we were able to contain it because people were willing that were at risk to take the vaccine and to take the antivirals. And so we were able to contain it and really dramatically slow the spread of it. But what is happening with so many viruses, Gemma? There are so many that people think, oh, you get infected and then that's it. But what we found and what is pointed out in this study is that it's not like that. There are a significant, in fact, in this study, it was 58% of people had lasting effects from that infection that lasted 11 to 18 months at the time they were being checked. And these could be, well, the most common thing was that they had persistent lesions or got discoloration of the skin or scars, and pox diseases are scarring. So that's not surprising, but it can be disfiguring even. Some people even had to have surgery to take care of these disfiguring scars. But also, that what we saw at the time, like I said, these lesions are very painful. If you get the lesions around your penis, which is the most common place to get it, it can be so painful and in a place on the penis where it actually makes it very difficult for you to urinate. And so now you not only have the pain, but you can't empty your bladder, which is also extremely painful. Or it can be around your anus, and that when you have it there, that there were people that could hardly not even defecate because the pain was so terrible. And so we saw lasting cases, not many, but there were people that had lasting problems with urinating or defecating. And we saw some people that because of the scarring, they had decreased range of motion of some of their extremities. And we even saw a couple cases of people with neurologic impairment. One person had vision impairment because if you get the pox virus close to your eyes, that can happen. Another person had problems with their gait. And a very common phenomenon with a lot of viruses after you have those persistent fatigue.
So, Dr. Pate, one part of this study that I found interesting as well is that the study links ongoing symptoms with socioeconomic factors, but stigma as well. So why is it important to understand that Mpox is not just a medical condition, but there's a social and a public health issue at play here as well?
Well, that's right. And certainly we've seen that play out right here in Idaho, as well as much of the part of the country, when we saw the movement by a couple of health districts here in Idaho to say, we're going to stop offering the COVID vaccine. Well, those COVID vaccines they were offering were for those people that didn't have any other way to get it. They were uninsured. They couldn't afford the vaccine. And so those kind of steps, those just hurt the poor, the vulnerable, the disenfranchised. We've seen it with school lunches. We've seen it with other programs where those that do have means are very willing to take away things from those that don't. And if we take away healthcare access from people who can't otherwise afford medical care, maybe don't have access to it, we see problems. And what is so short-sighted about it, even if you can't find it in your heart to care about people just for the sake of caring about them, is it comes back to haunt you. because we are so interconnected that if we allow these diseases to flourish in the poor, in disenfranchised, guess what? You still are going to come into contact with them. They may be people that do work for you. You may come across them in other venues, and it's a threat to the whole population. This was the same flaw when we decided, hey, let's not give any care or concern about immunocompromised people during COVID. Well, the immunocompromised people are the whole reason we got Omicron, which was in January of 2022, and we're still dealing with it. And so we have to learn that if we ignore some of our population, our community, we put everyone at risk.
Mm-hmm. So, Dr. Pate, given these findings, what should people who maybe had Mpox during that 2022 outbreak, or even people who are at high risk today because Mpox has not gone away, what should folks know about monitoring symptoms, vaccination, and really prevention going forward?
Yeah. So, first of all, if you're one of these individuals that is suffering with lingering effects, please know you're not alone. It's not something abnormal about you, and get help if you can. Seek help, and if you don't have access, talk to your local public health department. Also, there are clinics out there for those that are not insured, and so there are federally qualified health centers that you can look to, and we have some really great ones here in the Treasure Valley. So there are options for you, but do get help. Number two, if you're at high risk, just as you said, Gemma, this virus has not gone away. So talk with your provider about getting vaccinated, and whether you might be in a situation where you need a booster, and also be aware that there is an antiviral available if you should become infected. If you do get infected, make sure that you understand you are contagious to other people until those lesions heal. So please don't put other people at risk, and make sure that you isolate until those lesions are resolved.
Well, as always, Dr. Pate, so appreciate you and all of your science-based information. We've been speaking with Dr. David Pate, former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. And remember, folks, if you have a public health question for Dr. Pate, send us an email, idahomatters@boisestate.edu. I'm Gemma Gaudette, and this is Idaho Matters.
Looking for another podcast to listen to? Check out The Nature of Idaho from our partner station KISU in Eastern Idaho. Join hosts Peter Pruitt and Dr. Leif Tapanilla as they share fascinating stories from the Gem State's great outdoors, celebrating Idaho's wildlife, landscape, and natural wonders. That's The Nature of Idaho from KISU. Listen wherever you get your podcasts.